In an increasingly aging society,
we face a double challenge
how will we care for a growing elderly population
and cope with the shortage of healthcare workforce? This complex situation requires pioneering strategies and coordinated collaboration across the healthcare ecosystem.
Imagine if we were all in the right place, at the right time. Universities,
Tech companies,
pharma,
insurance,
startups,
institutions,
hospitals, and investors.
Let's join forces to turn today's healthcare challenges into tomorrow's healthcare opportunities.
What's more revolutionary than turning innovative ideas into real actions that make a positive impact on society?
To change the future,
We must act now.
be part of the revolution. Welcome to the Health Revolution Congress. Empowering health.
Next topic is empowering health organizations through managed data. Effective organization and management of data enable companies and institutions to optimize their time and add value to decision-making process, and also help to achieve their objectives. Next up, Martina Palladini from Praxys and Alex Brenchat and Javier Vincia from Banco Farmacéutico will join us to share their perspectives.
Good afternoon, everyone. It is an honor for us to be here on this stage. I want to thank Barcelona Health Hub for this amazing opportunity. And of course, I want to thank Alex and Javier for sharing this presentation with me. Now Javier is going to tell us a little bit about Banco Farmacéutico.
Banco Farmacéutico is a non-profit association founded in 2007 that promotes the social inclusion of people living in vulnerable situations, improving their health and fighting the pharmaceutical poverty. We promote a collaborative culture that allows obtaining financial sites to meet the needs of the medication and pharmaceutical products.
Thank you, Javier. At Praxys, we solve the healthcare industry challenges and its move towards digitalization. We specialize in technological solutions for the health sector, and we streamline daily work processes, optimizing information flows securely and in real time. Our solutions add value to the performance of insurance companies, social security institutions, pharmacies, pharmaceutical companies, and healthcare institutions. We're now here to present this use case from one of our verticals. While speaking with Javier Vincia, the director of Banco Farmacéutico, during a meeting here at the Barcelona Health Hub, he presented his challenges to us. Disaggregated data, uncontrolled data, and the lack of practical and dynamic access to information. I'm sure someone else might find these issues familiar, as these are current pains we see in various health management structures. That's why Banco Farmacéutico and us start working together, since we have 30 years of expertise in developing specific technological solutions for health management that allow us to understand the processes and the challenges faced by the healthcare sector, and to offer them tools to manage information and to contribute to streamline their work. That's why we start working together on data normalization to streamline their work processes, data normalization, and we minimized data duplication and anomalies. We improved the database performance and its accuracy. We created business intelligence dashboards, and we automate data collection, which allow us to minimize errors and to improve efficiency. We speed up data processing, and we gain the ability to collect data from multiple sources simultaneously, eliminating the need to download huge files for each query. The use of these information dashboards allowed Banco Farmacéutico to streamline their work processes, and the proposed data structure helped them very much. Now Alex is going to tell us a little bit more about pharmaceutical poverty.
Thank you, Martina. So as Martina was saying, the collaboration with Praxys has been very important to really see the information that you can see now in the screen. The main objective of Banco Farmacéutico is not only to help people, but to show the evidence that the pharmaceutical poverty is some reality. It's not just people cannot eat, cannot pay the energy invoices, they cannot also take the bills, take the medicines that they need for the treatments. So we have 3 types of poverties in the world: food poverty, people that cannot access the food; energy poverty, they cannot pay energy invoices, but also medicines are sometimes not able to be available to everybody because they don't have the money to pay for it. And then they have to choose between eating, having food, or taking the medicines, which if they don't take the medicines, that will increase the cost of the healthcare. So it's for us very important to have this information to show evidence to the society and governments that sometimes we need to be aware of these needs. We are in Banco Farmacéutico an NGO, an association to make this information clear and evident. We have published scientific articles with these results. And you can see here, thanks to Praxys, we can show data clearly and publish that. We have seen, you can see, we not only help people homeless, people without documented people. We are helping Spanish people that are in the TCI 3, so people like us that pay the 40% of the medicines. When you have a treatment, you have to pay the copayment, but they have lost the job, they have family issues, and they cannot afford paying the medicines. So you can see 45% Spanish people. You can see in total, most of the people are educated people. So you have only like 20% non-educated people. So it's not that we help homeless people, we help people like you, that you, in some circumstances, may be in a worse situation, not only yourself, but your family body in your household. You can see, and last information is to show that this graph showing that most of the people that we help have lost a job, are in special circumstances, maybe at some point they will be able to pay. So what we want to be able is to say that, okay, access to medicines is something universal. When we start 15 years ago, everybody said, no, there is no need in 2007. But we start asking, and now even hospitals and primary centers, health centers are asking us, even in hospitals, asking, can we get access to these medicines? So thanks to all this information, we can make the public, and this is the reason why we are very happy also to be here today to show you also this evidence of the pharmaceutical poverty. Thanks.
Thank you, Alex. Okay, to sum up, we won't want to take more of your time. We achieved, by working together, immediate access to accurate data, the visualization of all Banco Farmacéutico's historical records, how funds used, money spent, beneficiaries served, treated pathologies. We optimized the generation of annual reports, which is very important because...
Yes, and here I can really share. We had one FTE, one resource analyst to analyze and get this data, like we get just with one click, thanks to Praxys. We have real data, and live data, to know what is the profile of the people we are helping. And now this resource we can use for other purposes, like getting more funds, getting more other opportunities.
Thank you. We also gain the ability to analyze data by multiple variables, active ingredients, multi-level therapeutical groups, anonymized patients, laboratories, amounts, and epidemiological data. And last but not least, we minimize human error in data collection and in data processing. Okay, this was just our first step together, and we plan to continue working, facing new challenges. We want to empower other companies and institutions like Banco Farmacéutico to help them organize their information and to manage it efficiently so they can use their time and contribute their true value in decision-making and in the main mission of the company, which in this case is as important as fighting pharmaceutical poverty. Here are our websites. We invite all of you to follow us on LinkedIn and to visit our websites, and I would like to thank you all so much for your attention.
Maybe also to invite you, on the 13th of June, we will have the first time presenting what we call Observatory of Poverty, Pharmaceutical Poverty. It will be here in this place. Welcome.
Thank you.